Hello, my name is Kenneth Chappell. I'm a postdoctoral student at BCEP Hospital and member of the Moods team, and today I'd like to talk about pharmacogenetic analyses of antidepressant treatment response in depression. So depression remains a major and global public health issue, with treatments generally taking the form of antidepressant drugs. These treatments are intended to target neuronal levels of monoamine neurotransmitters, such as serotonin, which activate various downstream processes. However, despite their widespread use, only about 1/3 of treated patients successfully eliminate their depressive symptoms and achieve remission. Various factors can explain this difference in response, including one's own biology. And although there are various levels of biology to consider, today we'll focus on how genetic variation might influence treatment response. So there are several approaches to pharmacogenetic analysis. The candidate approach starts with a specific hypothesis in mind. For example, we might know of a variant that influences the expression of a drug metabolizing enzyme and wonder if it might also be associated with drug response. In contrast, the genome-wide approach analyzes millions of variants across the genome to identify those most associated with response, though how they might influence response isn't always understood. High-throughput sequencing can be applied to either approach and is useful for identifying both common and rare genetic variants. The Moods team has performed several pharmacogenetic studies across several candidate genes linked to drug metabolism, signaling, and serotonin. During my PhD, we wanted to continue exploring these serotonin-related variants and apply different strategies to their analysis. To do that, we analyzed patients of MEDADAP, a multicentric, prospective, and naturalistic treatment cohort of depressed patients receiving an antidepressant monotherapy with clinical assessments at baseline and after 1, 3, and 6 months of treatment. From the biological samples taken, DNA was extracted to identify variants using high-throughput sequencing according to a panel of psychiatry and antidepressant treatment-related candidate genes or using other genotyping methods. We first analyzed a recently described variant of IRH3, which influences serotonin levels, and like the other studies before, observed that patients carrying the CC genotype responded better to antidepressant treatment. Next, we observed that an accumulation of rare variants in RB1, which influences receptor signaling, was associated with worse improvement during antidepressant treatment. Then we analyzed variants of monoamine oxidase, which metabolizes serotonin, and observed that the A allele of this variant was associated with worse improvement in females, but better improvement in males. This was just a brief overview of some of the work I did during my PhD, so I invite you to check out the pharmacogenetic studies by the team, and of course to keep your eyes peeled for more to come.